nerves as well is found over there. Now there is another nerve in this picture which is good to know, and that is C2. C2 is called the greater occipital nerve. C2 or greater occipital nerve is this one. I don't know whether it is. Yes, it's written here. And that is actually over the suboccipital triangle. So that innervates, this is a purely sensory nerve, and it innervates the area above the suboccipital triangle. So this occipital region is innervated by this nerve that is C2. Okay, part of C2 is here, the greater occipital nerve. So these are good to know. Fortunately, there are not a lot of vessels here. There are some venous plexus and so on, and vessels and nerves are not very specific in the back. So as I said, the dorsal rami, they give the innervation to the skin of the back as well as to the muscles of the back, and some of the vessels that are derived from the thoracic aorta and other places, they give the blood supply to the back. In some universities, medical universities, even here in the United States, they even don't open the back. I can imagine that which is not good, to my opinion, on the cadaver, I mean. So you have to open it and look at it, although it may not have significant vessels, but it is actually a very important area, especially for those who want to become surgeons. Of course, in the medical education, they have to do it. So see some of these nerves, part of these C2, C3, C4, these are just found here in the back. Okay, so this was the back. Now let's go to the next slide. You see that this slide, I just tried to put actually half of this slide until the beginning of the muscle, a little bit of the muscles of the gluteal region, and the purpose was that really to avoid really putting pictures from other people really, now that we have the book. So this is found actually now in your web CT. This picture. We come to the lower limb, and by the way, the upper limb will be also in the lab, I guess. Do you have? I think the lab will also cover the upper limb as well, but the lecture may not. I have to make sure. Tomorrow I can give you a better answer. I just don't remember. I think the lecture, this lecture exam, by the way, is one of the, perhaps the easiest lecture exam. So please make sure that you will get a good grade on this lecture exam. And on purpose, I want you to get a better grade because then that will help you really to continue. So it's just, I think, the introduction file, the back, and the lower limb. The upper limb, I think, is in one of them, I don't remember the lecture of that. I think it's mostly the lecture which is not for the first lecture exam. And I wanted that to be like this, so a little bit, you started, so I didn't want to bombard you with material. So we come to the bones of the lower limb. This is the hip bone or innominate bone, because it's an irregular bone, not a particular shape. So innominate bone or hip bone is this bone. It has a posterior surface and an anterior surface, and the way how it is situated is actually in the body this view is the lateral view. You see, this is how it is situated in the body, so it's not really very posterior. It's a little bit oblique, so it is the lateral view, and that other view is the medial view. So that's why that you see the lateral view and medial view. This is another picture directly from another atlas. The bone consists of three parts. This part is called the ilium, and this is ischium, and this is the pubic part. The three parts, they fuse to each other in a Y-shaped manner in a hole, a big hole, which is seen on the lateral aspect of the bone, and that is called acetabulum. Acetabulum. So this hole is called acetabulum. However, it has a deeper part right in the center, which is called acetabular fossa. So this is the acetabular fossa. And this acetabular fossa is not completely covered, and the lower part of it is a little bit open, and this is called acetabular notch. So you see how these parts really have a name. So acetabulum, acetabular fossa, and acetabular notch. And this part is important because, first of all, the head of the femur actually articulates with the acetabulum, and that is the hip joint. So the hip joint is here where the head of the femur articulates with the acetabulum. Now, coming back to so this part actually fuses even during the teenage. So until the teenage, it is not completely fused. And when they fuse to each other, it becomes one of the firmest. So this is the primary cartilaginous joint that we'll be discussing in the joint section. And it's one of the firmest joint actually, this type of joint. Now let's go to the ilium and to see these parts of the ilium. These parts are very important. This bone actually will not leave us alone until the end of the course. So we come back to this bone repeatedly because in the pelvis, again, I want you to know this bone. And this bone has a lot of clinical significance as well. All parts of it are really important. So this is the iliac crest. You remember yesterday I was talking about the iliac crest. I said that when you touch the iliac crest and when you draw a line, that line is at which level then? L4. So this was this iliac crest. So this iliac crest is really here. So that's called intercrucial line. And then you are in a safe side. When you are approximating on the level of L4, you go a little bit up or down to this, and you insert your needle, you puncture. Of course, you have to disinfect the area, and then you go in for the lumbar puncture or spinal tap. Now, this has, of course, a lip, an outer lip, and an inner lip as well. And anteriorly, it is actually surrounded or ends or begins actually here by anterior superior iliac spine and posterior superior iliac spine. And you have here another counterpart for this anterior inferior iliac spine and posterior inferior iliac spine. So there are 4 iliac spines, and these are important to know, especially the anterior superior iliac spine, and has again some anatomical and clinical significance that will come back to this point. So it's good to know these bony points, and whatever I actually mentioned would be really some good questions in the lab as well. The iliac crest is used in practice for bone marrow extraction. We actually, especially we have the patient lying down, prone on the abdomen, and we anesthetize this area, disinfect and anesthetize, and then we go with a needle which is a little bit thicker perhaps. We get into the bone, and then we screw it a little bit. It's harsh sometimes, especially the nurses, they do that. So not only the doctors, and even in other countries, nurses do that. You puncture it, and when it is punctured, you feel that you went into a hollow space. So it's not, you don't see the resistance, you don't feel the resistance. And then you are in the place. Then